Recording in progress. Hello and welcome to another episode of the Serdentity podcast. And my guest today is the awesomely hilarious Alan Stern, Dr. Alan Stern, sorry.
The artist formerly known as
Yes,
Dr.
the artist formerly known as Dr. Alan Stern. Author of Enjoy the Ride, which is a wonderful, easy to read book. And it's basically the second half of Serdentity, serene dentistry. You know, Dr. Stern talks about enjoying life, and that's the goal of Serdentity, right? Serenity and dentistry, and you just really peg that in that book. We traded books when I met you.
Yes.
And I actually need to do a rewrite of Serdentity because when I wrote that book originally in 2013, I didn't know about the airway. I was a hygienist, but I had no idea. And I knew that there was trauma. So I knew that traumatized patients had a PTSD-like reaction. But I didn't know anything about the airway or about the neurobiology of trauma. So I only had half the puzzle. Once I went to myofunctional training, like the first 15 minutes of the course, I was like, oh my gosh, it's the airway. These people can't breathe. That's why they're traumatized. So, yeah, but I was going back over Enjoy the Ride yesterday, and it's like so full of good stuff. So thank you.
Beth, I cannot tell you seriously how much that means to me. And we can talk about that a little bit, but to be where I am today, even to be sitting with the likes of you, is an honor and privilege I never in my wildest dreams thought I would attain. Quite serious. So it's an honor, and it's also a responsibility that I take very seriously.
Responsibility.
Yep. And by the way, from the self-serving promotions department, my new book just came out, and you will receive a copy of it.
Oh, awesome.
Destination U, Wit, Wisdom, and a Glass of WHINE wine. And that I've got 71 Alanisms. The first 20 are in this book.
There's 71. That's awesome.
There are 71, too much for one volume because I'm going to release these slowly. And we'll be talking about them a lot as I move forward, because there are some truths that you and I both know that really need to get out, either in the form of your book, my book, or this book, whatever resonates with any given human being. I think you are on a sacred mission, as am I, to really make this profession take it back to what it needs to be.
Yes. So dental fear is real. Okay. Dentalfearcentral.org. You can get on there and read the stories of these patients who had these traumatic experiences. And what interests me is, I'll bet you there's somebody on Facebook complaining in a dental group about this rude, obnoxious patient. And it's two different sides of the same story.
Yes.
And my mission is to help dental professionals understand what is going on in the brains of these patients who are admittedly difficult to work with. But they're trying to survive. They have to breathe. And so that's my main goal. I also try to work in a little bit of what you're doing, which is we need to learn how to take care of ourselves so that we can have some serenity. Serdentity isn't about them. It's about me.
Yeah. Well, when you're flying somewhere, what do the flight attendants tell you if the oxygen masks come down?
That's
Put them
right.
on yourself first.
Yep. Well, my God, there's so many, when I look around in our profession, these codependent, suffering people that they have good intentions. They want to fill a void that's inside, but unless people, unless things go exactly the way they think they should, they remain unhappy.
Yeah. And you know what? We have a right. We have three unalienable rights in this country: the right to life, the right to liberty and the right to the pursuit of a Tesla. No, 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 wait a minute. The right to the pursuit of a big house. No,
Oh,
no, no. Life, liberty, and the pursuit of happiness. We're not guaranteed happiness.
no.
We're guaranteed the right to pursue it, whatever it is that's in your wheelhouse of happiness. What
Hmm.
makes you happy, Beth, is going to be different than what makes me happy because we are not the same person.
No.
And in the book, Alanism number 18 is more. There is more than one right answer. But to wallow in self-pity or to make a career out of victimhood and to profit by showing up as a victim,
Hmm.
I no one can't do that. To show up as somebody who has emerged from it
Hmm.
is a different story. And
Recovering victim.
we've all done that.
Hmm.
You don't know what baggage I'm carrying. Everybody's carrying something. And you know what? In our world, in our professional world, another Alanism is anger, is fear in disguise.
Yes,
So
yes,
what
yes, yes, yes.
when we encounter, first of all, fearful people were my favorite people to treat. I love that.
Hmm.
It was so much fun. The dentistry is what we do. Yeah, everybody, we can all do good dentistry. We can all do good dental hygiene or myotherapy
Hmm.
practices. We can all do that. But it's the human element that gives us joy.
Hmm.
I love that stuff. And that is why I'm doing what I'm doing here. I love interacting with people and trying to give them a pathway
Yeah.
to happiness. You don't have to be the highest level AACD accredited professional to be happy. It's great if you are.
Hmm.
But I know guys who are working in state prisons. I know guys who are
Hmm.
working in FQHCs,
Hmm.
and they're very tranquil, serene, serendipitous people. Uh,
I did nursing home dental hygiene for 13 years
it's awesome.
and I loved it. I've retired from clinical hygiene and I had to retire a little earlier from the nursing home hygiene because of my lower back. When you're working on people sitting straight up in a wheelchair or laying in a bed, and part of it's on me for not taking better care of my spine. But I had to finally stop because I just kept having these repeating sciatica issues, and but that broke my heart, because I really felt like I was doing something that was so necessary, and that
Mhm.
not a lot of like nobody else really cared to do it,
Yes.
and to me that was sacred to me,
Yep.
and I learned,
Everything.
yeah.
I'm sorry, Beth, go ahead,
No,
finish.
I learned a lot about dental fear, okay, from those nursing home patients because I had
Hmm.
patients with dementia that couldn't tell me what day it was, but they could tell me about their visit to the Eastman Dental Dispensary, 50 years, 60, 70 years prior. So
Hmm.
that's how powerful those experiences are. That's how powerful those memories are. It's not just a bad memory, it is a post traumatic locked in incident. And I also learned a lot about retained oral reflexes from my nursing home patients. I put those puzzle pieces together because I realized, oh my gosh, their cognitive function has declined to the point where they're back to primal reflexes.
Yeah.
And then I did some research and I found out that lo and behold, a lot of the general population still has retained oral reflexes. And these are the things that drive us crazy when we're trying to work in people's mouths.
Yeah. And there's nothing you can do about it except do your best to work around it
Right.
with the compassionate understanding that
Compassion.
you may never, compassion to the person, and note I don't use the word patient, the person, and to yourself. Because there is no way on God's good earth that a dental hygienist is going to remove every bit of deposits from an individual like that.
Right.
You can make them better. And sometimes that's the best we can do in dentistry, in hygiene. Look, when we have people in our office who are financially limited, there is but so much we can do.
Mm-hmm.
We can refer some of them to an FQHC, which I've done in my career. But there are people who choose to stay with a practitioner. Note, I didn't use the word provider. That's one of Alan's dirty 30
Right,
words.
right. I remember that from our
That's an
conversation.
obscene and disgusting word. And anybody who wants to challenge me on that, bring it. Because the word provider dehumanizes and devalues us. And I ain't standing for that. For people who go through years of education and thousands of dollars in continuing education and bust their chops, we're practitioners. Um, but sometimes we look, dentistry is expensive because dentistry is expensive. That's another Alanism. It costs a lot to deliver dentistry, no matter how much the individual practitioner gets paid. The overhead of dentistry is enormous. And I think I just relocated to a 55 and over geezer, I mean, active adult community. And I see people on the Facebook page bitching about how expensive dentistry is. And I'm trying to get into their continuing ed academy here and give a talk about the good, the bad, and the ugly about dentistry. There are some ugly realities. There are people who don't practice the way we would like them to practice. And there are people who come in expecting certain things, not understanding what the real cost of those things are. And that is everybody's fault. And that is where we really need to get out there and tell the raw, honest, vulnerable truth. That dentistry is available to just about everybody. And we need to consistently close that gap where just about is. But we also have to understand that you can't expect Ruth Chris Steakhouse if you're going to White Castle.
Right.
Both serve, both are legitimate establishments. No good, no bad here, but they are different. And you have to align your expectations with the reality. And if a dental practice is licensed to practice dentistry, they may practice at AACD level, or they may practice at FQHC level, or anywhere in between. And it's all okay as long as we tie together, as we connect the expectation with the reality and don't misrepresent anything.
Hippocrates said it's the relationship between the patient and the healer that creates the possibility of healing. And it's, to me, that's what's important.
Yes.
I refuse to have somebody leave my care feeling ashamed and in pain. And I don't know why my fellow hygienists seem to specialize in pain and shame. I call it the 3 S's: slam, shame, and sell. You slam the patient in the chair, you shame them about their oral hygiene, and then you sell them things from the practice.
Yeah. And you know what, Beth? When we started training, that's the way it was. And it was normal back then, just as certain other things we see today as normal behavior, we saw yesterday as normal behavior. We look back and we think, what the hell were we thinking? The first thing that comes to mind is racism. What the hell were we thinking back then? Bigotry, gender phobia. People, get over it. They're people. And it's not our job to judge them. In terms of a dental patient, there was an instructor in my dental school who bragged about the fact that he would remove some deposits from a patient's tooth, put it on a Ritz cracker, and ask if they wanted to eat it.
Come on.
That was the way it was. We all, as students, thought it was funny. Haha, these idiots don't know anything, and Dr. XYZ is showing them. We know better. We know better today. They didn't know better. And they didn't know better back in dental school days, where they did the same thing to us. Shame, slam, and then teach them how to do it. Break them down to build them up.
What is with that?
That works in the Army.
In the
armed forces, that is necessary. But that's not how we want to nurture and you hit the right word, Beth, healers. We need to go back and remember that we are healers.
So because dentistry is hands-on and it's technical, we're talking the difference between curing and healing. You can cure a disease and kill the patient. And
Yeah.
in hygiene school, if you killed the patient was fine as long as you removed all the tartar, all the calculus. They threw a bunch of teeth on the table and we had to identify them. I'm like, okay. But anyway, so in dentistry, I think we get hung up in curing. We want to cure. We got to get that tartar off there. We got to reduce that inflammation. We got to do that crown. And meanwhile, you know, the person that we're working on feels tortured, abused. And that's such a disconnect. And it makes me really sad.
Our friend Paul Henny talks about
I
this.
love him.
That, yeah, Paul has been a very good friend of mine for 20 plus years. And I've watched Paul grow. And if you're not in the Bob Barkley Study Club,
I am. I went there in
yeah. But to our listeners, look at Bob Barkley Study Club. Paul really has a very special grasp of
Mm-hmm.
what's going on
Yep.
because we can't heal people who don't want to be healed. On the other side of that is that dental health and health in general, dental health in particular, is very behavioral. You
Mm-hmm.
can do all of the hygiene you want. If I don't take care of it between hygiene appointments, you're not going to cure me.
Right.
I haven't missed a day of flossing since dental school. Why? Because I learned and I internalized the reward and the consequence of all that.
Right. Right.
And in order to do that, as a hygienist, as a dentist, as any practitioner, you really need to create a connection. You need to create mutual trust. You need to build rapport, and you need to lead and guide people with love in your heart.
Absolutely. That is
Without that,
core.
without that, it ain't gonna work.
That's the core of Serdentity. That love in your heart. And the serenity comes in because I am able to approach any dental patient with this non-judgmental, loving, compassionate energy, for
Yes.
lack of a better word, that puts them at ease instantly.
Yes.
I learned how to do that. I learned through my various experiences with life in therapy, in recovery. I took a little of this, a little of that. And I kind of mushed it all together. And, the last, especially since 2018, when I was, learned about the airway and myofunctional therapy, I can explain to people this is why you're reacting this way. Listen, oh, I'm a gagger. I know. I'm like, listen, you're not doing this on purpose because it's fun. Okay, this is a reflex. You are
Yes.
protecting your airway. And to be able to explain these things to people and help them understand that, you're not doing this on purpose. I am not angry at you. I don't ever have to say that out loud, but my attitude, I'm not angry with you. It's okay. We are going to get through this.
Yeah. And you know what, Beth, the other side of that coin as a practitioner, some practitioners will look at us and say, well, I tried that and it didn't work on Joe Jones. He barfed all over my chair. It's not going to work. Nothing's going to work 100% of the time.
Right.
Nothing. But and you talk about serdentity, if you in your heart know that you gave it your best with loving kindness toward another human being, you could at least walk away from that interaction knowing that you did what you do very, very well. And that's the part that we dentists, I'm not sure how you hygienists and myofunctional therapists do it, but dentists look at things that don't turn out perfect as another one of Alan's dirty 30, the F word, failure. I use a
Mm-hmm.
lot of F words because I lived for New Jersey for 42 years and then in New York for the balance up until a few weeks ago, with a sidebar in Virginia for my dental education. But the F word that I refuse to use, except when I work out, is failure.
Mm-hmm.
When
I'm
I'm
very
exercising,
impressed by all your workouts, by the way.
damn,
BTDs.
yeah, it's really good. I'm in a geezer community now. you wouldn't believe how many geezers are just about or even stronger than I am.
It's amazing.
Yeah, it can be done.
It can be
But
done.
but if we don't look at these things as F words,
Mm-hmm.
and rather we look at it either as a learning experience
Mm-hmm.
or as just something we did and we did not get the exact outcome we wanted, we in our hearts know that we practice as practitioners with loving kindness in addition to talent.
And so that failure word, there's a lot of us who have this deep-seated fear of failure because we feel we are a failure.
Yeah,
We feel that we're inherently defective, we're inherently wrong, there's something. And so every time I fail, that's just back to, oh, I'm a failure. And then that gets into this vortex of
yeah,
self-pity
yep,
and the victim martyr.
yep.
And my friend Don says, listen, get off the cross, we need the wood. Isn't that so great? I love that.
That's cool. But when we look at ourselves as works in progress
Mm-hmm.
from day one to day last, we can control that. We are wired with amygdalas
Mm-hmm.
or amygdalae, depending on your level of pseudo sophistication. Uh, you
It's
know,
like octopus.
yeah, this little amygdala back here
Mm-hmm.
require. We need it because if somebody's coming at us, if we're going north on Route 95 and somebody's coming at us southbound at 90 miles an hour in the same
Mm-hmm.
lane, we need
Mm-hmm.
that thing to kick in and say, fight, flight, or fear. Get the hell out of it. Swerve, do
Yep.
something.
Yep.
But what's happening as we're evolving, these first world problems that we have are not existential threats. One of my favorite Alanisms here in this book, Self-Serving Brilliant, is don't confuse a hemorrhoid for a tumor. Most of the things we get in dentistry that are adverse are really irritants and not existential threats. I mean,
Mm-hmm.
nasty gram from the IRS could be a tumor.
Mm-hmm.
If a sheriff's officer walks into your office with some papers with your name on it and brandishing a pair of handcuffs, that's a tumor.
Yeah.
God forbid you face a serious illness. Okay. But geez, you take an x-ray 6 months later and the margin of a crown is not ideal. That's a hemorrhoid. A patient leaves your office. That's a hemorrhoid.
Mm-hmm.
Hemorrhoids are treatable.
Very.
Tumors require a little bit more intensity. But
Mm-hmm.
most of these things are hemorrhoid. We are endowed with a prefrontal cortex, which can override the
Yes.
the reflex of amygdala. So it's always going to be there, and it's up to us to process these reactions and put them in the category in which they belong.
Mm-hmm.
Get some mental preparation, H, for heaven's sake.
Um, so, in the trauma response, it's the primitive brain that's reacting first.
Mm-hmm.
And so then the thinking brain tries to, okay, what's going on here? And sometimes, the thinking brain creates a story that's not really true. And our approach, yours and mine, is very important in these days of Google reviews.
Yeah.
And when a patient has a bad experience in your office because you've traumatized them, they can get on Google and tell their side of the story. And it's a bad review. And if it's really bad, if that patient feels like you don't care about them, they can sue you. My new favorite word is liticophobia.
I like that.
It's the irrational fear of being sued. And
Yep.
that seems to be a tremendous driver in a lot of these dental professionals that I see complaining in these dental groups.
Yeah.
And the solution seems to be just dump them, get rid of them. And so they're going to go somewhere else. And I've had the experience of we're treating patients who have been dismissed and dismissed and dismissed. And, because I cared about them for 30 minutes, lo and behold.
Yeah. You know, in dentistry having changed over our personal and professional lifetimes,
It has.
there is a difference. Dr. Bob, who was my dentist through childhood, hung out his shingle in the basement of an apartment building. I grew up in an apartment building in Queens, New York. And the people came, they busted his door down.
Mm-hmm.
Dr. Bob retired very comfortably, still alive and well, pushing 100, somewhere in Florida.
Yep, of course.
Dr. Bob's son was one of my closest friends, still is a dear friend out in California. But Dr. Bob just did his thing. They came, they went, and that was it.
Mm-hmm.
But dentistry has segmented, as Paul teaches us. There are different tiers of dentistry. And there are also, we all have different personalities now. We're not the only act in town.
Mm-hmm.
So if an individual leaves your practice, if they dump you or if you dump them, it may be that you're just not a good fit.
This is true.
I wanted to be Serdentitus in the
Ooh.
last 10 years of my career, 10 or 15 years. And, there were certain things that I did not want to cater to. And you know what, Ms. Jones, I'm sorry you feel that way.
Mm-hmm.
It's neither good nor bad. We're neither right nor wrong, but we may not be a good match.
Mm-hmm.
May I suggest that you find somebody else?
Yeah.
And, if you do it nicely, once
Mm-hmm.
again, you may walk out pissed off. Can I say that?
Sure.
Okay, thank you. They may
Absolutely.
walk out pissed off, but you and your soul will know that you did the right thing for yourself because you may not have the emotional wherewithal to
Mm-hmm.
deal with a certain specific type of individual.
Mm-hmm.
But you in your heart know that you did it with compassion and care to a human
Mm-hmm.
being who has an irreducible need for love and belonging.
I might be, well, I'm a freaking codependent healthcare provider. What are you kidding? Or professional, excuse me, practitioner.
That's it. Don't.
So,
That's a provider. I'm sorry.
I'm a people pleaser, right? And so sometimes I absolutely agree with what you just said. And I think it's, sort of probably a shortcoming on my part to think that I can, serdentitize everybody. But darn it all, it works pretty often.
You know what? You're not perfect. Get the hell out. Ooh, I said a Jersey word. You're not perfect. Get over it. And nobody's going to please everybody. I mean, my wife still doesn't like. No, that's not true. But you're, you'll never please every. Nobody will.
Right.
But if you act within your values, and that's what integrity is, by the way. Integrity is behaving consistently with your core values.
Mm-hmm.
If you identify your core values, Beth,
Mm-hmm.
and every action and every word that you say to your imperfect best is
Mm-hmm.
consistent with that, then you will have a Serdentitus or myotherapy, Sir Myoe, Sir
Yeah.
Myodentity, Sir something.
Right.
You'll have more tranquility and less stress.
That's
I
the
think,
yes, more tranquility, less stress.
yeah, not zero.
Not zero, because life is life.
Alanism #1, show me a person without stress and I'll show you a cadaver.
I saw that when I was going over your book last night.
And by the way, when we're offline, I'll tell you Alanism #1A that will never be published or set in public.
I can tell it's a Jerseyism.
It
No, that's Queens. That's going all the way.
this
That's
one,
throwing it way
yeah,
back.
we don't want to do that. If anybody wants to hear Alanism 1A, get in touch with me and we'll speak before I do that so you get to know me a little bit better. But dentistry is a great career. And I think we have lost track of that for many reasons. And what I try to do and what you try to do is to try to get people refocused
Mm-hmm.
on the nature of our work, get back to the why,
Mm-hmm.
get back to the healing thing and get the hell out of the provider thing
Mm-hmm.
and get out of the, oh, get this pain in the out of here.
Mm-hmm.
This is a human being with real needs. This is a soul.
Human being.
Yeah.
You know, reading this one in this one Facebook group, the doctor referred to the patient as a pimple on my tush. And that really made me upset. I'm like,
I
this
had
is a human being.
I had a client who fired me, and that's okay. I'm not for everybody. Said, hygiene patients keep canceling. A hygiene patient keeps canceling. How can I get this pain in the ass? I don't want this pain in the ass anymore. And I wrote about it in the book. I never said it to the person, but I said, if you're dealing with pains in the ass, you need to be in another element of healthcare that deals with the other side of the GI tract. If you want pains in the ass, be a
Mm-hmm.
proctologist
Mm-hmm.
or
That's
a
right.
GI specialist. But people who are demanding or angry are scared.
Yes, yes, yes. That is it. People who come in defensive, their amygdala is like woo loo loo.
Yep.
They're expecting to be traumatized. They are expecting, so if they're coming in defensive, and when we come at that the defensiveness with, legality, or, I'm the boss here, I'm going to tell you what you need, or, anything like that, it's not going to go well. It's a power
And we
struggle.
do that, and we do that as practitioners because we are scared. We are
Mm-hmm.
out of touch with our core values. And once we get back and center ourselves, Serdentity, Sirhygienity, or Sir what you make up the thing
Just
there.
Serdentity is fine.
Yeah, you all of a sudden become a more tranquil practitioner and doing great work in the world.
I have literally had to stop myself and center myself and say that serenity prayer before I approached um, a patient, because I knew this patient had been, flagged, and I'd heard them screaming at the person in the front. And so, and I'm thinking to myself, girl, if you're going to write a book about this stuff, you better get in there and do some, you better show up. So I had to take a minute and say, wow, you know what? I'm really scared here. Um, and ask my higher power, whatever, however an individual wants to refer to it, for help. And once I was able to do that, I was able to walk into that room and sit down face to face, eye to eye with this patient and say, hi, my name is Beth, and I'm going to take good care of you today.
Yeah.
In that voice,
Mm-hmm.
not like, my name's Beth, I'm going to clean your teeth.
Yeah. Yep.
And this poor woman had been, handed around. She had a long history of domestic abuse and facial trauma. And so I absolutely understood where she was coming from. And at the end of 30 minutes, she was just about in tears because someone cared.
Yeah. Yep. I have a great success story about somebody we both know that I'll tell you off camera because I don't want to reveal the identity of that person. But a dear friend of mine went through a prosthodontic residency, and he was given the most difficult patients by the graduates.
Mm-hmm.
And he calls me up and he said, what do I do about Miss McNasty here, who's just has ripped the heads off of my previous residents? And I said to him, remember, this person is angry. If you can get to the root of the anger, you will create something. And he sure as hell did.
Mm-hmm.
He sure as hell did.
That's
So,
that's awesome.
you know what a dentist and hygienist's most important instruments are?
Oh, the ears. Yes. Listening.
Yep. Yep.
Oh, right.
Yeah. So that's very important. Man, it's
Well,
been,
it is. Although I certainly like to listen to myself more than anybody else. But
sorry, I like to listen to myself more. So, well, and remember, I'm a dentist. This is all about me.
oh, right, right. Sorry, forgot.
Right. That's right. Um, I am going to invite you to do something like this on my site on Better, Richer, Stronger, and we'll have a little bit of fun together.
Mm-hmm.
Um, I think I'm very honored and pleased to be with the likes of you. I think your mission, like my mission, they used to call it soft skills. These are critical essentials in these times,
Mm-hmm.
and they always have been. We just didn't realize it.
Right.
So, Beth, let's keep going. Let's keep the message out there and
Absolutely.
keep the fire burning. Because if we save one career,
Mm-hmm.
we save the world.
Absolutely. And we have been chatting for almost an hour. This is my longest podcast ever.
Wow,
So,
yeah. I just looked down at the clock and I said, holy,
right.
yeah.
Well, what time flies when we're engaged in mutually passionate topics.
May I have your permission to reward anybody who has stuck it out this long? Because we've exceeded the attention span.
Yeah, that's what I usually like half an hour.
Yep. Anybody who has made it to the end, if you message me through or Alan at betterricherstronger.com, email me and I will gift you a copy of Destination U. And you're getting one anyway, Beth. I might even autograph yours if you're nice to me.
Woo! I
So
can't. Oh, go ahead. We were going to
if
finish.
you're here at the end and you want a copy of my book, please just, if you've heard this, Alan at betterricherstronger.com, and I would be delighted to send you this as a gift.
Alan, I can't even tell you how much I've enjoyed this. I knew it was going to be great. I knew that, but it has exceeded my expectations in terms of greatness, and I really appreciate you taking the time to speak with me.
It is my pleasure, Beth. I'll see you again.
All right.
Bye, everybody.
Bye bye.